Hi everyone, welcome back to my channel. If you're new here, I'm Nataliia Sanzo, a registered dietitian specializing in Hashimoto's hypothyroidism. Today we're diving into a topic that does not get nearly enough attention: thyroid antibodies. Specifically, we're going to explore what you might not know about them and how they relate to Hashimoto's. Trust me, this information can really change your understanding of Hashimoto's. Now, if you have Hashimoto's or know someone who does, you might be familiar with terms like TPO antibodies and TG antibodies. These are the antibodies that our immune system mistakenly produces, thinking our thyroid gland is the enemy. But there is so much more to these antibodies than just their names, so let's break it down. First off, let's get the basics out of the way. Our thyroid produces TPO and TG. Yep, you heard it right. TPO is actually an enzyme produced by our thyroid gland and is crucial for the production of thyroid hormone. TG, thyroglobulin, is the glycoprotein, again produced by our thyroid gland, and is the main precursor to thyroid hormone. In Hashimoto's, the immune system attacks the thyroid gland. This attack is primarily mediated by two types of antibodies: TPO antibody and TG antibody. It is not the actual TPO and TG that attacks your thyroid gland. It is the antibodies created by our immune system. These antibodies target the thyroid gland, leading to inflammation and, over time, hypothyroidism. But why does this happen? The exact cause isn't fully understood, but it is believed to involve a mix of genetic predisposition and environmental triggers like stress, infections, or even dietary factors. Now, here's where it gets interesting. Did you know that the presence of thyroid antibodies can actually precede the diagnosis of hypothyroidism by many years? Some studies suggest that TPO antibodies can be present for decades before any symptoms of hypothyroidism show up. This means that if you are tested early, you could potentially take steps to manage your thyroid health before more serious symptoms arise. Guys, another fascinating point is that not everyone with high levels of thyroid antibodies will develop hypothyroidism. It's a bit of a mystery why some people with elevated antibodies never progress to full-blown hypothyroidism, while others do. This variability suggests that there are other factors at play, such as lifestyle, diet, and possibly other underlying conditions. Guys, have you ever noticed your TPO antibodies fluctuation for no apparent reasons? Here's a fascinating detail. TPO antibodies can fluctuate significantly in response to various factors, including pregnancy, infections, and even seasonal changes. Pregnancy, for instance, often leads to a temporary reduction in TPO antibodies, providing a sort of immune tolerance that protects the developing baby. However, postpartum, these levels can spike and sometimes leading to postpartum thyroiditis, a condition that can evolve into Hashimoto. Now, let me ask you a question. Are your antibodies high? Let's say you already did a full thyroid panel, whatever that means to you, and you know your TPO antibodies level. But what do they mean? Is antibody level of 400 or 4,000 too high? The new research shows that TPO levels of 100 or 1,000 is not a sign of one disease worse than the other. But I want to emphasize that research also says that TPO antibodies are indicators of oxidative stress, and patients with low or non-measurable thyroid antibodies present with milder form of the disease. You might be wondering, if thyroid antibodies are so important, why don't all doctors measure them routinely? Well, there are a few reasons for this. First, not all cases of hypothyroidism are caused by Hashimoto's thyroiditis. Many doctors prioritize testing TSH, thyroid stimulating hormone, and free T3 levels to assess thyroid function initially. These tests are generally sufficient to diagnose hypothyroidism and guide medical treatment. Secondly, the presence of thyroid antibodies does not always change the treatment plan. Even if antibodies are elevated, the primary treatment for hypothyroidism remains thyroid hormone replacement therapy. Therefore, some doctors may feel that measuring antibodies won't significantly impact the approach to treatment. The third reason why doctors don't measure TPO antibodies is because there is also the consideration of cost and insurance coverage. Some insurance plans may not cover the cost of antibody testing unless there is a clear clinical indication. This can influence a doctor's decision on whether to order these tests. So if doctors are not testing it or treating it, what can you do to lower your TPO antibodies? Well, at this point, we have 5 proven ways to lower thyroid antibodies. In order not to turn our episode into a 2-hour-long lecture, today we'll talk about 2 proven ways to lower your thyroid TPO antibodies, and our listeners can read about the other 3 approaches in my free guide attached to this episode. The first way to lower TPO antibodies is to improve your gut health. The earliest evidence suggests that gut health is closely linked to thyroid health, and that improving gut health can decrease thyroid antibodies and balance your thyroid hormones. In addition, research shows that a range of gut treatments may improve fatigue, mild to moderate depression, anxiety, brain fog, constipation, and other things. Here's several ways you can work on improving your gut health. First, anti-inflammatory diet. A low-quality diet is typically the single biggest source of inflammation that can impair your thyroid and immune function, which can inevitably lead to worsening Hashimoto's related symptoms. Luckily, evidence shows that changing your diet can lower thyroid antibodies. A low-carbohydrate diet was shown in one study to reduce thyroid antibodies by 44% in people with Hashimoto's. In addition, a gluten-free diet was shown to reduce thyroid antibodies in the group of women with Hashimoto's hypothyroidism. I think they had like 38 women. Other studies have shown that eliminating dairy and gluten may help improve thyroid function, but the jury is still out on that. A paleo diet template is a low-carb, dairy-free, and gluten-free, and maybe it's a good place to start. Another way to improve your gut health and in turn lower your thyroid antibodies is to check for gut infections. Gut infections such as H. pylori, SIBO, small intestinal bacteria overgrowth, and Blastocystis hominis are associated with elevated thyroid antibodies, and treating these infections may reduce TPO antibodies. In my all-purpose nutrition practice, I use and recommend a GI map testing. It's a stool test that checks for chronic infections like Epstein-Barr virus, parasites, and much more. The final thing I want to talk about is probiotics. Probiotics have nothing to do with lowering TPO antibodies directly, but probiotics have been shown in multiple studies to improve the gut infections that are associated with elevated thyroid antibodies, including H. pylori and SIBO. I talk about exactly which probiotics to take in the free guide that is attached to this episode. Guys, let me know if you want me to cover supplements that have been proven to lower TPO antibodies. Leave me a comment under this episode. Guys, you know what to do. If you found this information helpful, don't forget to give this episode a thumbs up, share it with anyone who might benefit, and subscribe to my channel for more tips on managing Hashimoto's and improving your overall health. Stay nourished and well. See you next week.